Yeah, Dr. Saraswati? Yeah, okay. All right.
Yeah, hi again.
Okay. Yeah.
Do I screen share again?
Yeah, do that.
Okay. So you go to the advanced, right?
Yes, the
Screen sharing.
share screen. You don't have to go to the advanced. In the basic, you have to share a window. You have to keep the PPT open in the background.
Okay. Can you see it now?
Yeah, I can see your slides now. Yes, I can see your slides.
Okay,
Can you see yourself?
Yes, I can.
Okay. So we'll just hold it there. I had people joining in, right? Okay, fine. So let's just hold it there. Yeah. So there are people joining in. I think.
Just click here and see.
You can just try changing your slides. Put that on the slideshow. Yeah. Okay.
Okay, so let me just try changing from one slide to another.
Yes.
Yeah?
Perfect.
Okay. All right.
There would be a lag, Doc. There would be a lag of a couple of seconds. So in case if you don't see the command being taken, just stop share and redo it. Because there will be an overlap of commands, no? And on Zoom, it usually gets stuck up there. So it gets hanged. All right. So, okay. So let me just take a bit and introduce a speaker for today. All right. So we do have participants joining in, I think, because it's a Saturday evening and guys, tomorrow is Valentine's Day, so I didn't want to schedule it on 14th. So just to keep all of us free so that we don't listen from our respective Valentines. Okay, so that's the whole idea. Okay, so Dr. Saraswathi Shanbhag. Yeah, I just want to give a brief introduction about the talk here. Now, Dr. Saraswathi Shanbhag is someone who has been into dental practice for a very long time in terms of the expertise. She's been running individually her practice for the last 17 years. Dr. Saraswati has completed her BDS from Maharashtra University and holds a fellowship in implantology and periodontics from the Chicago Center of Advanced Dentistry in the year 2005. She also holds a master's in healthcare services from the Sikkim Manipal University, which she completed in the year 2016. Yeah, is my video and audio clear, Doc? Is that clear? Coming out? All good?
Yeah, all good.
All right. Okay. Now, Dr. Saraswati is someone who has been into various formats of practice, right? And her experience spans from everything related to working in the Maharashtra's, her work experience, or rather the education programs which he's developed upon. The various workshops and conferences vary from the health and the wellness tourism, which was held up by the state of Maharashtra. Then we also had the Nobel Biocare World Tour, which she was really a part of and learned a lot of information and knowledge gained from there. There's also the Road to Excellence in Implantology at the 12th National Conference of the Indian Society of Oral Implantologists. Then her accolades also include courses from the lasers and dentistry from the Indian Academy of Laser Dentistry. Also being a part of the scientific program by the Indian Academy of Aesthetic and Cosmetic Dentistry, then endopore implant system, then oral cancer prevention programs, even management of bypass and angio-treated cardiac patients by the dental setup, at the Holy Family Hospital in the year 2005. And also modern endodontics, the basic and the advanced courses. So we see there is a varied list of background of experiences which a speaker has accumulated over the years. So these are the terminologies, guys. I mean, all of you all who are attending this webinar right away would be looking forward to setting up a dental practice. Now, this is a common conjunction where we don't really know how to go by it. Okay. Now, for some strange reason, the dental colleges teach you the art and the science of dentistry, but they don't teach you the business of dentistry. They don't teach you the practice management and what is actually real dentistry in the real world. So to enlighten all of us today about this topic, it gives me immense pleasure to welcome Dr. Saraswathi Shanbhag to our PhD 101 webinar series. Thank you so much, Doc, for taking your time. And as a practitioner, again, it does mean a lot that this is your core time, and it's so lovely to have you here. Welcome, Doc.
Thank you, Dr. Denzi. In fact, it's an honor, to present in front of this audience. I mean, on a Saturday evening, like you said, probably Valentine's Eve, we are doing this. And thank you for giving me this opportunity.
All right, Doc. Yes. So I think with this background information, over to Dr. Saraswathi so that she can share her experiences and give us tips and tricks on how we can, build on a successful dental practice. Everything from the positioning in the market to the surveying of the population to what were her bits of the journey. So over to you, Doc.
Yeah. So good evening, everyone, once again. Now, Dr. Denzi has actually spoken quite a bit about me and the conferences attended. That's coming again in the slides, but there is also a reason why I'm doing it. And before we start, most clinical tips that I will be sharing are from personal experience. So as we go along the presentation, I am sort of going to be sharing my professional journey, my professional life story with you. Feel free to interrupt, or I don't know if Dr. Denzi, you want to take this towards the end, if there are any questions or if there are any doubts.
We'll do that towards the end.
Yeah. Okay. All right. So I'm Dr. Saraswathi Shanbhag, 17 years of experience, 17 years of clinical experience. My clinic is 9 years old. I did BDS from Rural Dental College from Pravra we were the first batch which passed out from the university, the Bombay, Pune, all those universities clubbed together, and it was called Maharashtra University of Health Sciences. So that was in 2003. Now, the fellowship that I did in implantology and periodontics was an affiliation with Chicago Center for Advanced Dentistry done here in Mumbai. It was a 6-month thing which I did under Dr. Kumarswamy in 2005. Now, what did I do from 2003 to 2005 is the question. One, most of us are, wanting to do our MDS. So yeah, that is what I also did. I gave all those CETs and all those national examinations trying to, get a seat in MDS. But the mistake I made here was I also started working as an observer at my father's friend's clinic. One of my father's closest friend was a dentist, and that's where I started with my observership. A lot of my seniors told me that if you're focusing on studies, focus on studies. If you're focusing on having a private practice, then you start with an observership or an apprenticeship. But I guess one learns only from one's experience. So the reason I'm telling you this is, if you all are focused on doing your MDS, if there is further studies that you want to pursue, then probably getting into clinical practice is not the correct choice. All right, moving ahead. So 2 years from 2003 to 2005, I worked as an observer, and I also joined a charitable trust, working independently as a dentist. Now, one might say, why a charitable trust? Again, I wanted to explore, dentistry on my own. I don't know why. I'm not saying one should, but you do get to learn a lot when you move out on your own. So the fellowship again really helped me, because in 2005 there was hardly anyone doing these fellowship in implantology and periodontics. Like, implants was still very, very new in India. Hardly anyone was doing it clinically. And if I look at it today, 15 years, 16 years hence, implant is a regular practice. Like, a patient walks in right now and you want to do an implant, it's possible. So if you feel there is something, some course which is going to be of value 10 years hence, I strongly recommend you learn it today. Sign up for these certification programs, sign up for the fellowship, sign up for, any course which you think is going to be the future of dentistry, whether it's robotics. I mean, I don't know what's the in thing now. The last thing that I heard was robotics in dentistry. So if that is the in thing, yeah, please sign up for something like that. Next, I did a master's in healthcare services. Now, this is actually what we call a MBA in common lingo. Now, if you see, that was done in 2016. Now, why did I want to do this in 2016? What difference does it make? I'm a clinical dentist. I'm a general dentist who pursues implants and, does those gum surgeries. So I did this because I started with my clinic in 2012. And I was also a consult. I am also a consultant at one of the corporate hospitals here in Bombay. So what happens is most of the corporate lingo is not taught to us. The corporate world is very different from our healthcare world. And I felt the need to do a master's or an MBA in healthcare services. Luckily, it was an online program, and 2 years it could be very easily done while sitting here in the clinic, with those online examinations. So again, if you're looking at increasing your knowledge, this is something I recommend. I think Dr. Denzi spoke about all these continuing dental education workshops and conferences. Guys, the more you learn, the more you attend these conferences and workshops, right? The more it is going to help you in your clinical practice. Now, if you look at this slide, this is only a portion of what I have attended. Now, let's look at this scientific program by the Aesthetic and Cosmetic Dentistry. All right. Then there is something which I attended was oral cancer prevention. If you look at it, it's quite varied. Now, why would one want to do such stuff? The reason for this is when you attend these conferences, you will probably know what you want to pursue in your clinical practice. Whether you want to be an aesthetic dentist, whether you want to get into cancer research, or you want to do implants, or you want to get into, completely cosmetic treatment, because nowadays dentists along with dermatologists are also doing Botox and fillers. There is one more thing here. Maharashtra's first health and wellness tourism conference held in 2018. If anything like this comes up, I strongly recommend that one attends it. There were people from South Africa and the US, from UK, everywhere attending these, and it was a very good experience. If you're looking at dental tourism in future, I know it's a little different right now with COVID here, but India is well on the map of dental tourism. Now, making the choice and planning your career. When you pass out, you will probably want to have a general dental practice. If you have a master's in oral surgery or orthodontics or pediatrics, you would want to pursue a specialty dental practice. You can go and get into academics into research, or as a professor. Right now, the corporate healthcare scene is quite strong in India. We have a lot of these corporate hospitals which are taking in dentists as full-timers, or you can choose to be a consultant. Now, why does a consultancy, at a hospital help you in your clinical practice? There are specific cases where people have extreme phobia of dental treatment, and these are adults and mostly kids, pediatric patients. So there are a lot of cases that we do now at the hospital under sedation, because you have a lot of hands ready in case there is a complication. And hospital attachment will also help you deal with patients who are medically compromised. So there are cases, I did a case under GA for a special child. So if you're looking at varied things in your private practice, you can look at a hospital consultancy. The next thing is pursuing a career abroad. So these choices need to be made within the first 2 years of your passing out, or maybe even sooner if you plan to practice MDS, if you plan to get a specialization. Now, I will be speaking specifically about general dental practice. I take great pride in saying that I'm a general dentist and a self-made one at that. How would one choose the location of practice? My first thing here is to be an observer. Now, I don't know if it makes sense, when I say be an observer, iska or location ka kya lena dena? I worked as an observer, I think, at least 5 different clinics. Now, how did that help me? How is it going to help you being an observer? One, every clinic will have a different pattern. Every dentist will have a different pattern of working. Every dentist will have different materials that they are comfortable working with. And every dentist will have different people walking in, and every case is going to be different. So what you need to do when you pass out is approach a dentist who is probably a family friend or someone in the vicinity. Go through the entire process of wanting to be an observer. Tell them that we've heard about your practice and we would like to come and just observe what you do. Trust me, guys, this will observing is going to teach you more than 4 years of dental schooling. I'm sorry to say that, but yeah, the practical experience always comes in, when you set out of dental college. Now, the second thing here is volunteer to become the dental assistant at a clinic. Now, by dental assistant, I don't mean an associate doctor. I'm asking you to be a dental chairside assistant. Yes, holding the suction, being the dental chairside assistant is the best spot that you can be in. Why? Because it is going to give you a direct view and direct access to what your dentist is doing in a patient's mouth. There are times when, my dental assistants have told me, ma'am, there seems to be an overhang, there's a bit of a primer uh, left lingually. So these things, you will actually know the fine nuances only by being at the suction end of the dental chair. So I know most of us don't look at it very highly. You would be like, मैं तो dentist हूँ, मैं pass out होके आया हूँ या आई हूँ, I'm going to glove up and start working on patients. Trust me, guys, there is plenty of time to work on patients. आप पूरी जिंदगी अभी यही करने वाले हो. That's the reason we all signed up for dental schooling, right? We signed up to become a dentist. So take some time out, hold that suction, observe the surgeries, observe how a filling is done, observe how the isolation is done, observe how the patient is comfortable or uncomfortable with different positions of the suction pipe. Because when you are going to be operating, you will have to actually train your staff to hold the suction properly. Yeah. The next point here is work at different clinics. Now, by different clinics, I don't mean you start a job, at a place for 6 months, quit there, go to another clinic, quit there, and go to the third one. No, I personally did this. Work at 2 different clinics. Generally, dentists are used to working with a morning shift, a break in the afternoon, and an evening shift. So my suggestion here is, now I'm sure I'll be speaking for Bombay. Like, Bombay has a lot of suburbs. I'm not sure about other cities, how it works. But let's say, in the mornings, I'm working in Ghatkopar. In the evenings, I would be working at Prabhadevi or at a clinic in Bandra or in Santa Cruz. Now, how does that help me? Every location will, attract a different patient population. Like probably in Ghatkopar, we will not have many people wanting to get veneers done. Maybe the same thing is not true for a clinic in Bandra. So every suburb will have a target audience, will have different patient demands, and that is going to help you to know where you want to set up your practice. Because let's say I am someone who loves doing veneers, who loves doing aesthetic dentistry. There is no point in having a clinic in a suburb where there is no demand for it. So work at different clinics, like I said, probably in 2 different shifts. Also, again, it helps you to learn the different patterns of working. Now, while you are working, as an associate dentist, ask as many questions as you want. Ask the dentist, ये material आप क्यों use कर रहे हो? Why 3N? Why ivoclar? Why this bonding agent? Why an etching agent? What sealer are we using? इसका setting time कितना है? You know, ask all questions. Better still, how I once had a doctor, I'm not going to take any names. I was working for someone, and the dentist actually asked one of the MRs कि ये looting agent में कितने cap हम लोग fit कर सकते हैं. I was quite surprised. I'm like, what kind of a question is this? Why has doctor asked this question? So after that I checked with my dentist, and the answer I got was, we need to know the price per unit. Now, this is a very clinical thing I'm talking about. Let's say your looting cement costs 4,000 bucks and you can only use it for 40 crowns. You know what your per crown cost is. You know what to charge your patient. Because when we pass out, now you want to use the best. Okay? Ye best chahiye, wo best chahiye, but you may not have that kind of a person walking in. Or let's say you have somebody like that, paying capacity nahi ho sakti hai. So you need to ask as many questions at the time when you are working with somebody, because the questions might sound stupid today, but then they will help you make a decision when you are starting with your clinic. Now the last point here is, what type of practice do you want? I think, colloquially we broadly classify it into mass practice and class practice. So I don't agree with that, because I feel a dentist doesn't have the same charges for, even within the same clinic. Because obviously you have a patient who has walked in with pain. What are you going to do? Are you going to refuse treatment because you have X, charges as your consultation fees? Or you have an X amount as your root canal treatment fees? I personally don't choose to do that. Of course, you need to have a baseline charge there, a fixed charge there. And then if you want, you can consider, depending on the kind of patient who has walked in. So what type of practice you want, whether you want to, have this mass practice, or whether which works on volumes, whether you want to have class practice where you're saying, I'm only going to do implants and I'm only going to do aesthetic dentistry, or you want a mix of both. That is something you need to decide. Okay. The most important thing here is have a mentor. Now, who is a mentor and why do we need a mentor? बचपन से लेके आज तक कोई भी चीज हमने अकेले की है? How successful have you been? Most of us have learned to drive a car, right? Did you learn it with somebody, या आप खुद ही बैठ गए वो गाड़ी में? You learned swimming. You needed a teacher there. You needed a coach. You went to dental school. Before that, you went to school. Before that, you had your mother, your father, your elder sibling who have been mentors. You're going to need a mentor in dentistry, and that mentoring is going to be lifelong. I have friends as mentors. You can choose your mentor. The mentor doesn't have to be the same gender, the same age. That doesn't matter. Now, who is this mentor going to be? And what is this mentor going to do? There are going to be good days of practice and there are going to be bad days of practice. What are the good days? My first implant. I'm excited. I need to share this. Will my mother understand that it was a difficult surgery and I managed to do this and I managed to do that? No. Who is going to understand your first good case in implants? Your mentor. You need to share this information. Likewise, there's a complication. You try to put in an implant, the implant sunk in. What are you going to do? Who is your go-to guy? Or let's say there is a difficult case. You need to call your mentor to discuss this. That's where a mentor is going to be. And if you don't have good days and bad days, maybe you could just share a coffee or share a beer with that mentor. Just speak your heart out about dentistry to him. So there are some of these do's for the clinician. The first thing is be pleasant. Everyone likes a pleasant personality. यार कल मैं जिम गई थी, आज मेरे को बहुत पेन हो रहा है, my whole body is aching, and now this patient has come in with pain. I have a sad face, I'm sulking. आज क्यों आया है यार? I can't do this extraction. What's happening? No, nobody, especially a patient who walks in, doesn't want to see you sulking. He's already in pain. So be pleasant. Be skillful. Keep learning. Keep upgrading. Learn the newest techniques. Have a friendly approach. Be ethical and be compassionate. Next most important point is listen to your patient. Most often what happens is, or used to happen when I started working, the patient comes in, you are so excited to work, we ask the patient, अच्छा क्या हो रहा है? दर्द हो रहा है ना? अच्छा बैठ जाओ, आ जाओ. Patient opens the mouth. हाँ, इसमें ना रूट कैनाल चाहिए. ये तो एकदम होपलेस केस है, इसको ये दांत को निकाल दो. Imagine yourself being in that position. You are already scared. The patient has probably not come to the tooth which is so badly carious, but has come for some gum abscess which is on the other side of the mouth. But you have not bothered to listen to the patient. So let the patient talk, let the patient narrate to you as to what his chief complaint is. Once that is done, then go ahead to make a diagnosis and a treatment plan and educate the patient about the same. Now, while while we are educating the patient, if we tell the patient आपको root canal की जरूरत है या ये दांत में caries हो गया है, what is the patient going to understand? In my first year of dental schooling, I didn't know what caries is. Caries sounded like one alien word, और तब तो Google भी नहीं था शायद, and so ये caries क्या होता है? The patient will be like, caries क्या होता है? So use very simple language. Use the word decay. In your regional language, if there is some other word for it, use that. A lot of time we also say कीड़ा लग गया है. I know it sounds funny, but that is the general terminology used. So you can say कीड़ लग गई है, या there is decay. You explain what a root canal is in very, very simple language. If you start explaining to the patient about BMP and मैं जो अभी filling करने वाली हूँ ये composite है, ये वो है, he or she is not going to understand. You have to use very simple words and tell him or her that this is a tooth colored filling. This is far superior and the latest that is available today. You're doing a root canal, tell the patient that there are roots for a tooth, that there are two parts, there is a crown and a root. The root has a nerve or a pulp space. Again, you can't use the word pulp, so you say there is a nerve space, और हम ये दांत की नस बदलने वाले हैं. Those are the kind of words you will have to use. So yeah, so we've covered explaining the procedure in simple words. Now, intend to provide good service always. The reason I say this is, if you walk in with a completely business-minded approach, you're going to reach nowhere. Your intention has to be very clear. I'm not saying don't charge. You should charge because you're here to earn a living. But let your intention be very, very clear. Provide good service, provide value for money. There are single sitting root canals done these days. That's good service, right? You have trained yourself to do these. So take pride in it. Explain to the patient. If you feel you are a little on the higher side as far as the charges go, explain to the patient that you spent so many years doing this, or you have taken up this course which will help you to serve him or her better. Again, constantly upgrade your knowledge of newer materials as well as techniques. Like I said earlier, plenty. I think nowadays they also have the entire calendar for the year, of particular conferences and this course and that course. So I guess one can go through this and plan once every 2 or 3 months. All right. Next thing is to build and maintain friendships with your colleagues, especially associated with the healthcare industry. Now, what do I mean by this? Now, of course, you are friends with, your fellow dentists and probably a few from the medical fraternity. But you also need to build relationships with, let's say, a technician at a dialysis unit. Why? Because they frequently have patients who are diabetics and who are going to need dental treatment. So think a little out of the box, and I'm saying maintain genuine, build and maintain genuine friendships with these people. There will be X-ray technicians, there will be these lab technicians, there will be pathologists. So get in touch with them and tell them you started a new practice and to refer patients. We finished with the do's, now the don'ts. What comes to your mind when I say pink horse? Did most of us think of a horse that is pink in color? So what will happen when you tell your patient you are not going to get pain? Yeah? So never utter the word pain. We can substitute the word pain with discomfort. So let's say a patient is here for a procedure. He's already full of anxiety. The dental clinic, unfortunately, everything looks like an injection. Everything is in a syringe form. Everything looks like a needle. And then the dentist looks like a monster who's, just going to come and poke you with something. And it's a very intimidating position to be in, the patient's chair. And on top of that, if you tell the patient, don't worry, you're not going to get any pain. You're not going to get any pain. Don't worry at all. The minute you keep saying pain, 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 that's all the patient hears. He cannot hear the words, don't worry. He will only hear the word pain. So assure your patient there won't be any, there's just going to be maybe mild discomfort. I'm giving you a shot and I'm here to take care of it. And trust me, this has worked miraculously for me over the last so many years. I've just stopped using that word pain. In fact, when the patient says, pain hoga na, dard hoga na, I tell them not at all. It's not going to hurt you because that's what we trained in for 5 long years at the dental school. The next point here is to not encourage bargaining. I'm not saying don't have flexible charges, but when you start your practice, and especially when you're new to your practice, there'll be a lot of people who will want to take advantage of you being new here. And let's say you say I'm going to charge you $1,000 for this. Are nahi, doctor sahab, 600 rupees mein karo na. Now, if you have to think, this never happens in any other medical field. There will be no one going to a physician's clinic and telling them that 1,000 rupees is overcharging. They'll never tell the receptionist 1,000 ka 800 le lo na. For some reason I've noticed this only in the dental office. So do not encourage this. Yes, what you could do is you can charge the patient 1,000 and you could give away a freebie. What I frequently do is I have some, toothpaste or some sort of a toy for kids. I have some toothbrushes as gifts for older patients. So you could make the patient happy by, giving away a freebie, but never encourage bargaining. As you start your practice, you'll know who genuinely cannot pay. Yes, have flexible charges for them, but never bow down to someone who just wants to bargain, because you are going to set your value here. Again, the next don't is never talk ill of your fellow dentist. Sometimes it does happen, some work done is not very good according to you. But again, that's your perspective. We don't know why the previous dentist did it, right? You don't know if your patient has gone somewhere else after 2 months or after 2 years. Probably the filling doesn't look as good as it used to be, as good as you did it. So one rule here is never ever talk ill about your dentist. In fact, build a very healthy relationship with your neighborhood dentist. Because there are a lot of times that the patient will have half the work done at your neighborhood clinic and come to you for the remaining half. There are cases where the patient has had the entire crown prep done by another dentist, and they'll come to you and they'll tell you, nay, that dentist is traveling, he's out of town, nay, abhi humko jamta nahi hai. So for all you know, they haven't even paid their fees. So we need to help each other grow. We don't need to pull each other down. And last but not the least here is to not make a bad day at work a bad day at home as well. Like I said in the start, there are going to be bad days. We are all starting afresh. Although we have a lot of theoretical knowledge, there is going to be that one case. If you've done 5 good fillings, there is going to be one filling where there was a lot of salivation and, the patient was not cooperative. Something or the other will keep happening. Don't carry it back in your head. Don't carry it home. Don't keep mulling over the same thing, because you are just going to make a bad, uh, day at home from a bad day at the clinic, and it's not worth it. There is life beyond dentistry. So stick to your clinical work only in the clinic. The minute you step out of your clinic, you should forget all about your patients. Dr. Denzi, do we need to break here?
Yes, I think, no, I think you can just continue.
Should I continue?
It's fine, it's fine.
Okay, because I can't really interact with the audience.
Yeah, I think we could have a small break here. I mean, can we have people, the participants, because there are some who could pitch in their experiences. I think we have some practitioners who are here. All right. Yes, Dr. Imran, Dr. Gargi. Oh, we have Dr. Vikrant as well. If you could just pitch in and give us anything so far you'd like to add on. Okay. All right, Doctor. I think we can continue.
Okay.
Yes.
Hi, Denzi.
Oh, yeah. Hi, Vikrant sir.
I was really enjoying the talk right now. Thanks a lot, ma'am, for engaging with such practical tips. I think it's going great.
Thank you, doctor.
Yeah, I think it's I still will stay hooked, though I don't practice personally, but then I still would stay hooked to know more about what is happening.
Sure. Thank you, sir. Thank you so much.
Yeah.
This is Dr. Vikrant, who's joined us from Delhi. Sir is associate professor and heading the department in Maulana Azad Institute of Medical Sciences.
Okay.
Yes, Dr. Saraswathi.
Yeah, I'm sorry, I stand corrected. Associate professor.
Oh, yes.
It's okay. It's okay. Then they're just pulling a leg. Thank you. Please carry on, please.
Yeah. Okay, sir. Thank you. Yes, Dr. Saraswathi, please continue.
Okay. Now we come to the furnishing and equipment part of a clinic. Again, like I had said earlier, when we start off new, we are very enthusiastic, about our practices. I'm going to buy the latest thing available. We never really think of, if you're going to make use of it in the near future. It so happens that we've bought an implant kit, but we don't know how to do implants. Or I've bought the latest matrix system and I don't know how to use it. So my advice here is start slow, buy only those things, as many as you require initially, and then you can always upgrade. Now, I've mentioned that you share or rent expensive must-have equipment. I have a very close friend from college. His bleaching unit is constantly in my clinic. In fact, there are times when he has to ask me for it, that and remind me that ye mera hai, please, I have a case and let me use it. Likewise, we share an implant surgical unit, we share the physio dispensers. These are equipments which need a lot of investment initially. And when you start out, you may not have as many patients for these things. So a wise thing to do is sharing it. Or nowadays, a lot of companies also rent these out. So you can look at that option. Now, my favorite here is investing in a very good suction machine. I noticed when I was working at multiple clinics, right? Most use the chair side suction, which is not very powerful. And then the dentist would be like, shoving in those cotton rolls and those cheek pads, and I don't know what not. Itna sab karke, you remove the band or you remove the cotton, and the GIC used to pop out along with it. The composite would fracture in a couple of days, and the patient would be back. You wasted first an hour doing that filling, controlling all the moisture and the saliva, and worse still, you are repeating it in 2 days. And more damage is when the patient goes back and says, मैं तो 2 बार गया और मेरा filling निकल गया. So investing in a good suction machine is something I feel is going to help you do good dentistry. More than having a good, a chair unit, I would say invest in a good suction machine if you have to choose. Again, the same thing with an autoclave. We don't want cross-contamination, and you want to provide good service to your patients. And a dental stool is the chair that a dentist sits in. So why you need a good dental stool is, you don't realize this when you start out, when you slowly cross 35 and then you cross 40, you start presenting with cervical issues, back issues, lower back issues. How can you stop this? How can you control this? By maintaining proper chair position and by having a good dental stool. So if you have to invest in something when you start off with your clinic, invest in a good suction machine, an autoclave, and your dental stool. You could probably compromise a little on the kind of chair you are going to use, because the patient is going to be there only for a few minutes, maximum an hour. But you are going to be sitting on that stool for an entire day. All right. So use soothing colors wherever possible. We all like our reds and blacks. In fact, my presentation has this red glaring at us. A red dress or a black dress definitely looks nice, but something that's red or orange in the clinic is only going to cause more anxiety to the patients. There is a palette of cool colors. I'm sure most of us are aware of it. The blues, the greens, the mild yellows are supposed to be very soothing and calming. Try and have these colors in your operatory as well as in your waiting area. Now, have comfortable seating in your waiting area, because when a patient walks in again, it just in case you're late or your previous appointment has taken some time, we don't want the patient to be uncomfortable. So see to it that it's easily you can clean the surfaces of these and it's comfortable for the patient. Music, again, a lot of clinics have music. Music is supposed to calm your nerves. So this is something you can choose. Again, today a lot of options are available. There's Bluetooth, and earlier we just had those speakers. We had to do that inbuilt wiring or pata nahi kya kya karna padta tha. So things are relatively easier now. Now, videos of procedures is something I'm not a very big fan of, because as much as they are good videos, it still shows a patient coming in with pain. Then suddenly there is the picture of an injection and a needle, and then that goes and pricks somewhere. Although it's an animation, I mean, I don't see the need to have these procedural videos in your waiting area. You could probably, share videos of these procedures, animations. Again, I'm talking only the animations. Once you have explained the procedure to the patient, why, अगर वो aesthetic treatment के लिए आया है, why do you want to show him the procedure of an extraction? I mean, a tooth coming out, even if it's an animation, is not a pretty sight. Or let's say, there was dental decay with a patient's front teeth, and you have done a damn good job of, correcting it with the latest composites and all. Why does the patient need to see such decayed teeth? It's definitely not a pretty sight. So again, suit yourself, but this is something I definitely don't prefer to have in the waiting area. And more importantly, your waiting area and your clinic should have your vibe, because your vibe is what your patients are going to connect with. at the end of the day. See, you're not going to be able to please everybody, right? There are going to be patients who will say, "Ye doctor ko kuch nahi aata hai. I'm not happy." The patient walks in with the strongest recommendation, may not be happy with your service. You have to let it go. So let your clinic, let your staff speak your language. Let your vibe be seen in your clinic. Now, first impressions. Some of us believe that first impressions are last impressions. I would like to say first impression is a lasting impression. Yeah. So what do we need to do? How are you going to make a good first impression? So be your patient. What I mean by this is when you walk into your operatory, when you walk into your clinic waiting area, enter your clinic as a patient would. Come in, sit down, ask your staff to greet you, to speak to you as they would to a patient. You want to teach them the local language, you want to speak, want them to speak to the patient in English, you have to train them. So be your patient, sit there. 10 minutes pehle jao for the first month, sit down in your waiting area, look around. You will see where there are cobwebs, you will see where things are, slightly out of place. You will actually see your clinic from the patient's perspective. Train your front desk staff. Your front desk staff needs to be cheerful. They need to be polite and friendly, all at the same time. Like I said, you're having a bad day at home. आज किसी के घर में झगड़ा हुआ है या किसी का और कोई प्रॉब्लम हुआ है. They still need to come here. They need to smile. Your front desk staff is the first interaction your patient is going to have. And imagine if the first interaction is not good. The patient has already built that thing in his mind that, oh, this is my experience in the front desk, at the front desk. What's going to happen inside? After all, your patient is meeting you for the first time. So train your staff to be cheerful. And we are dentists. We more than anyone else, we and our staff need to put on those smiles. With COVID again, it's a little difficult because we are all behind our masks. But I'm hopeful that it's going to change very soon. We're going to go back to the normal. So try and use patient management software. A lot of these are now available in the market and it hardly costs you anything. I think the cost per month is probably less than 1,000 rupees and it's all worth it. Earlier, we used to have those, patient records in the form of files. Now you can do the same thing by using a patient management software. Some of the companies, they give you a tab which serves as your file. The patient walks in, you make the patient register. It has many different categories which will give you the dental history, previous dental history, the medical history of the patient. It also has columns of where you have the stock or the inventory. So all these things will help you in management of your clinic. Again, it helps you to schedule appointments for your patients. Let's say a patient came to you in 2018 and you're using the same software, all right? And for whatever reason, the treatment couldn't be continued at the time. You're not going to go back to your diary of 2018 and look for the patient record. So this becomes easy. You just, fill in the patient's name. You get a complete record of, when the patient visited, for what the patient visited, how many appointments were completed. So it just makes the whole process easier. Again, nowadays, these tags which you use for patient management have those selfie, what do you say? Your patient is allowed to take a selfie. So that again is very popular with kids. Like I said, if it's a good experience, the patient will stick to you. Again, ensure minimum waiting time. Try to stick to appointments. It shouldn't be that you have an appointment at 5 o'clock and you are walking in at 5:15. Respect everyone's time. We all saw what happened, when there was a little bit of a glitch today from 6 to 6:15 or 6:10. We weren't really happy about it, right? After all, it's a Saturday night. So the same thing happens to your patient. Your patient has already traveled, had a long day at work, and after that he or she is waiting for around 15 minutes, half an hour. It's not going to go down well. And trust me, when you stick to your timings and when you stick to your appointment timings, inform the patient that it's going to take an hour, because the patient comes prepared for it. And when you stick to it, he or she is going to strongly recommend you and respect you for it. And I'm speaking from personal experience completely. I have patients traveling from all over Bombay only for this reason. Now, the last thing here is to brand your clinic. Now, I have a clinic by the name of 32 Not Out. I have a friend in advertising who helped me with it. Wasn't my brainwave. Earlier, I had a clinic by the name of the Dental Square. So another friend asked me, ये dental square का क्या मतलब है? I said, कोई मतलब नहीं है. मुझे dental circle रखना था, dental circle के कुछ तो था, तो मैंने dental square रख दिया. He's like, the Times Square or the New York Square, they all have relevant names. He was like, are you aware of this? So I was like, not really. I said, but I like the name Dental Square. So he said, ठीक है, suit yourself. 2 years down the line, I Googled the Dental Square. There was one in Raipur, there was one in Juhu, there was one somewhere else. We are in an online world. We all need to go online, whether it's Google Business, whether it's social media, whether it's Instagram. And if there are multiple dental squares there, how is the patient going to contact you? So that's why the change, and that's why you need to brand your clinic. It allows you to scale up in the future. Let's say you want to have 10 other branches in future, right? So having a brand right in the start will help you do this. It just makes the whole process much easier. And also locating you on Google, is far easier for the patient. So choose a good brand name, and like I said, it hardly costs anything. And it's a one-time thing to be done. Yeah, the importance of networking. Now, who do you think is going to be your best patient? The one who has come with a strong recommendation, right? Whether it's from a previous patient, whether it's from your building, whether it's from your gym, whether it's from your dance class, anyone who has come with a strong recommendation कि ये dentist अच्छा है, तुम इसके पास जाओ, is going to stick to you. When a patient comes in with a recommendation, half your job is done because the patient already has faith in you. All you have to do is provide with good service. Now, how will you network? I've already told you why you need networking, because recommendation helps. Now, how will you network? There are a lot many networking groups today as compared to 15 years ago. Networking groups, there are different networking groups. There are Saturday clubs, then there are these weekly networking groups, there are monthly networking groups. Apart from these, there are also some online networking groups. I think if you go on to Facebook, there is each area has a networking group, like the Powai Members Association or Ghatkopar Club and likes of it. So get onto these groups. You can promote your clinic on it from time to time. Other things, as soon as you pass out, what you can do is you can join a Rotaract club in your area. Apart from that, volunteer for a social cause at your gymkhana. If there are any social gatherings in your society, let's say for Ganpati or for Diwali, every society, every community has something or the other happening, some festivities. So participate in those, be proactive, let people know you, basically be visible. Now, how is it going to help you? Are we doing this only so that these people refer patients to you? The answer is no. In fact, this should never be done with the mind, by keeping in mind that मैं इधर जा रहा हूँ, मैं ये गणपति पंडाल सेटअप करने जा रहा हूँ ताकि मेरे को पेशेंट आएगा इधर से. No, that is not what you're going to do. That should never be your intention. The truth is, be visible, business will follow. You network today, business might come in maybe 2 years down the line. It's not like, I went for this marathon, I volunteered, I did this, I didn't get any patient. Within 2 months, you're expecting a patient to come to your clinic. That's not going to happen. And apart from, wanting to get patients through these sources, most importantly, it's going to shape your personality. Because sitting in a dental clinic, who are you interacting with the whole day? You cannot have personal talks with a patient after all. I mean, the patient walks in, you can't ask him, "Oh, तेरे घर पे काम चल रहा है, मैंने सुना, false ceiling कौन सा बना रहा है, कौन सा color palette use कर रहा है." The patient will think you've gone crazy. So where are you going to have these conversations? Because in your dental office, the truth is you're only going to interact with your associate doctor if you have one, or with your dental staff. Your interactions with the patient are going to be very, very professional. So when you become part of these, networking groups, it shapes your personality in multiple ways. It will sharpen your professional skills. It will tell you how to take a lecture. It will tell you what to talk in front of people, how to talk, how to present yourself. It will probably, educate you on which tie goes with which shirt. I mean, it's a wide variety of learning that one can have. More importantly, you will be doing something apart from dentistry. Like I said, ये चार दीवारी में बैठ के आप कुछ नहीं सीखोगे except dentistry. But joining a road track will teach you a lot of other things. You will learn to give to the community. And last but not the least, you will make friends and friends for life, because these are healthy interactions which one is going to have. जो बिना कोई मतलब के है. Like I said, if you're going to expect कि हाँ मैं अभी जा रहा हूँ, मेरे को इधर से patient आना चाहिए, no, that's not going to last. So when you have these interactions as friends, those friendships are going to last forever. Now, look for synergies with other professionals. Now, this requires a bit of out of the box thinking. Now, by other professionals, what I mean is, let's say there is a yoga teacher, in the same complex as yours, where you have your clinic. Now, how will you have synergy with them? Now, yoga teachers frequently have, pregnant women coming for pregnancy yoga. They have people with other ailments, like let's say thyroid issues or diabetes or something else walking in. So you can collaborate with this yoga teacher and educate them about dental findings in medically compromised patients, or dental findings in patients who have systemic disorders. So these kind of collaborations, I have seen them working for me. Likewise with professions such as a photographer. Let's say someone wants to get a portfolio done. Obviously they will be conscious of their smile. And if you have a good rapport with one of those portfolio guys, they can refer patients to you. So you need to do a bit of this, out of the box thinking, and see who else can refer patients to you. The use of social media, I am not too great at social media myself, but I think there are many experts, of social media. I've seen it working for a lot of people. Again, when we use social media specifically to dentistry, I would say the teeth will, the before and after pictures of teeth will not make a very pretty picture. That is what my friends have always told me, and I have put up such pictures in presentations before, and it hasn't been very likable. Like, people are not very comfortable for some reason. Probably we don't realize it because we see it day in, day out. So if you're using social media, maybe you could have those dental tips. For example, different ways of brushing, or the commonest way of brushing, the time for which one needs to brush, the amount of toothpaste which needs to be used. You'll be surprised to know that patients still don't know these things. वो जैसे ad में दिखाते हैं ना, you have a toothbrush and you apply the paste to the entire length of that brush. So, you know, that is what is still happening. So if you have to use social media, my advice here is, you know, make animations or make small creatives where, you know, educate the people on, educate them with these dental tips rather than the before and after pictures of your cases. So that is the end of my presentation. And thank you, everyone. Thank you for the patient listening. And like I said, all that I have told you is, what do you call it? Aap beeti kehte hain na Hindi mein usko. So these are, yeah, they're not in any book. This is what I've learned from my experience. So thank you, Dr. Denzi, for giving me the opportunity to share it. And thank you, dear audience, for putting up with this on a Saturday night.
Yes, Dr. Saraswathi, thank you so much. I think it's really important, whatever you shared today, all the experiences, because these are specifically what the books and the colleges don't teach, because this comes from experience over the years, and every single bit, I would call it the honest presentation ever. This is really good, because this is exactly what I wanted you to share, for our participants as well as everyone who will be watching this. Right, guys. So I think thank you so much for doing this. And I think if we have some time, we can quickly have some interaction with the audience.
Yeah, Denzi, I have a question to ask.
Please stop.
Yeah, Dr. Shanbhag, thank you so much. It was really kind of you to elaborate so eloquently on all the aspects of, on how dental practice can be integrated and carried forward. But I just wanted to know one thing. See, I teach in a dental school, in a dental college, and I'm totally committed to a dental college. And whatever you said right now, I cannot talk about the clinical aspect, because I more or less I am into the public health domain, like how Denzi is. Right. I specialize in public health dentistry, and I've been practicing public health dentistry to the soul. From the day one I started practicing. So what I wanted to know was what exactly dental education. You said that dental school is not going to teach you everything, and it is going to be what the years after dental school is what going to matter most, because that's where your learning are. But see, surely 5 years of time is not less time. So you should be able to tell us, like, what exactly do you think should change, whatever, wherever possible, whoever can do it, because it's not, if you make it mandatory, I don't think so people will enjoy doing it. But what changes do you think can you bring in dental practice management during dental education that will at least sensitize students more towards what you're talking about? Because it took you some time to learn all this. But today's generation is they want to learn quickly, and it's always nice to have more integrated teaching learning methods rather than having like this training post education. So what would be your suggestion that we could actually incorporate during training in dental colleges?
So Dr. Vikrant, I don't know about the schooling, the dental curriculum right now, but I can only speak from my time, which was in way back in 98. All right. Now, when we gave our exams or when we learned, we used to do hand scaling. We used to use those curates. And I have never done hand scaling in my life in clinical dentistry. And so I'm not saying that, hand scaling shouldn't be taught. But why are we not teaching about ultrasonic scalers? Because when I passed out, मुझे मालूम ही नहीं था कि ultrasonic scalers क्या है. In fact, now I'm even forgetting, when I started practice, there was, these scalers from Dentsply, which are also now outdated. Now we have those Woodpecker and other brands, those ultrasonic scalers. ये school, dental college में कभी use ही नहीं किया. We sit and do scaling for hours and hours and hours. I mean, break my back and break my neck, and उसके बाद भी गाली खाते थे हम teachers से.
ज्यादा कुछ बदला नहीं है डॉक्टर साहब.
नहीं, I think it's almost same, but then sure in internship, at least students in our college are actually obviously using ultrasonics, no doubt. No, because rather than asking you more about a question, you already partly answered my question, but
Mhm.
I just like to tell you about what is happening in dental school today. At least I can give
Sure.
you my because I have developed, devised, ways how we could like whatever you're speaking, I can relate to it, though I'm not a practitioner at all. I'm telling you, I work in a
Mhm.
government hospital. Even Manazad is a government hospital. I'm not allowed to practice, and I don't practice also. Whatever I do in my college hours only. So we started this during internship. We started something like dental clinic design management.
Mhm.
We started this dental practice management short module that we developed,
Mhm.
and it was totally a very individual. At least at my departmental level, we started this. What we used to do is, जो dental technician है, जो basically the person who is handling the dental chairs and all that maintenance, उसको हम बुलाते थे. He would orient about how exactly a space can be planned for setting up. I'm sorry, my daughters keep quiet. So she what do you call that, कि कैसे हम dental chair place करें, how do we plan, what do we have and keep in mind. I know this is still beyond what is realistic, but still we wanted to give that feel that students get to know कि dental chair में अगर कुछ खराब होता है, they should know where the filters are. I know none of us actually in dental clinical practice go and open those filters and clean them. Maybe I'm not sure, because what you do I may not know, but then these students weren't knowing that ये यहाँ पर ये सब filters होता है, और ये basic चीजें we orient them about a chair. They only know how to put the handpiece, do the filling, leave the handpiece, and just go. They're not bothered about all these things. We started talking about what is preventive maintenance in an autoclave, preventive maintenance of a aerota, preventive maintenance of a micromotor handpiece, and is tarah se we developed a small package of training that the students are oriented during internship actually.
Okay, okay. So, doctor,
And
I think that's a very good thing which all have started. I mean, that you have enlightened me about, because when I was in dental school, they didn't teach us this. I learned
no,
about
they
the filters in
they
my
don't teach.
clinic.
They don't teach as of now. Also, I'm
As
telling
of
you,
now,
Gen
Acha,
Z
they
will
don't
agree
teach.
to me.
you
Yes,
They
have
yes,
don't
to.
still.
absolutely,
They,
absolutely.
they don't still don't teach all these things. It's
Yes,
just that it is out of my interest. I started
yes.
because I always felt that because I have been very, I'm sorry, I have to move out from one room to another because the children are. So these the we started these things only because we felt that there was a need for all these things. and uh,
Absolutely.
and we always felt, I always personally always felt that we talk a lot about preventive dentistry. We talk and we practice also. During non-COVID times, just before COVID set in, at least we used to perform around 10 fluoride applications and at least 20 20 individual teeth sealant applications every day in our dental clinic. So that was
Yes.
the kind of impact we had, and we do a lot of other things which obviously maybe in private practice it might be a little difficult to perform, but still as a training part we do a lot of tobacco cessation. I've been instrumental in working in tobacco cessation for last 10 years now, and we've done a lot of progress, and Denzi knows about it though.
Yes, yes.
But just sharing with you that we have a very good operational tobacco cessation clinic, and we've been working, and as you said, working with Rotaract, working with Lions Club, working with Leo. All these things are really something which has become more important with times today, and it surely gives students a much more broader. Previously, I still enjoy. I studied from Dharwad, so I know how what it meant to actually be a part of community activities and be outreach programs. I surely miss those fun today, but I still don't see that fun happening today. Even if you give the opportunity to students, at least in big metros like Delhi, that students don't enjoy all that. In smaller towns, obviously, I believe that that is where the most of the bonding happens actually.
Thank you so much, Dr. Vikrant, for actually sharing experiences. And I totally touch upon. I mean, I've seen Dr. Vikrant at work in action with the amazing work. Uh, Coming to the issue, yes, dental practice. I think we have Rajshri with us, who's just completed her final BDS, who's got into internship. Let's hear from you, Rajshri, that what you think you should have been taught, or do you see yourself? Wanting to do MDS just because you don't have the courage to start your own practice. So let's hear your thoughts from a student as well.
Right, sir. Thank you. Thank you for giving me the opportunity. And anyway, I had few questions to ask ma'am because she has been so honest and outspoken. I've seen people being very, slyly letting go of the questions and not giving a direct answer. But I could get most of the answers right from your presentation slides. So thank you for that wonderful presentation, ma'am. And even Vikrant sir, I thank him for having highlighted some of the important things. My mother being an architect, I always felt the need to know, the aspect of designing a dental clinic because we are lay persons in that matter. We have absolutely no idea where to put the chair, where the compressor comes, where the autoclave has to be kept. And there is I've seen clinics with no concept of dark room. So these are some important things that I really agree with, sir. And also, one more thing I felt that is lacking in the undergraduate curriculum is about research. Because these days, students are ending up doing research, but I feel like they follow a blind track. They probably do something that another person has already done again. So it is not an individual effort. It is something, a spoon feeding kind of thing. Sorry to use that word. So I
Yes.
think people have to be taught what exactly is research, why it is done, how to do it, on your own, and who are the people involved, because most of the students would never know that they had to involve a statistician probably for an original research. So these are the things that I think can be taught, because now we are progressing further. And even digital dentistry and lasers can be brought in greater depth, I feel like. When we omit the older practices and bring in the things that are actually going on in the contemporary world, it will really help us, in putting up our own practice. And the question I have with Dr. Saraswati ma'am is that I'm currently pursuing my internship, and I don't know, my parents enlightened me to do observership in the second and third year of BDS. So I have experience with observerships, but what I personally feel is that observing, probably we get to know about 20% of what's going on, but the rest of the 80% comes when we practice. That's what I felt. So I want your suggestions on how to utilize these 9 months of my internship to the best. Most of my questions were already answered in your presentation. So I personally felt like I must get exposed to different practitioners, their techniques, their materials, like you said.
Right.
But what's the ideal duration for that? I felt like I can keep switching in 3 or 4 months, because that would help me get exposed to greater, more number of people or specialists. What's your opinion on that, ma'am?
So, Rajeshri, what happens is, no, if you switch every 3 or 4 months, all right, like I said, there is a patient, let's say there is an implant case. There are times when you load an implant after 3 months. So the prosthetic
Right.
part of that, I mean, how that particular dentist, handles the prosthetic part of that particular case is something you're not going to know. Plus, what happens is the best thing to do in this case, work that morning and evening shift. Like the mornings in one
Right.
clinic, the evenings in another clinic. Because again, what will happen with this is the longer time, the longer the duration that you are with one dentist, you may want to, pursue a similar kind of practice. If you keep changing every 3 to 4 months, it could lead to a lot of confusion. कि
Right, ma'am.
अच्छा मुझे aesthetics भी अच्छा लग रहा है. I like restorative dentistry as well. I like endodontics as well. So it will lead to more confusion. And plus, I feel in a span of 3 months, you will hardly get to, observe or learn anything. Another thing that you mentioned is your parents asked you to get into observership in your second and third year of BDS, right?
Right.
Rajeshri, I don't know about you, but when I was in my second and third year of BDS, I didn't even want to attend the lectures. I'm being very honest about it. Leave alone go somewhere as an observer. So I feel the amount that we take in during observership when you are still studying,
Right.
is not going to be significant, because half the time your mind will be like, "Arey, aaj Facebook pe kya hua?" Which is the latest movie, which is the latest web series which has come in. So your
Yeah.
attention is not really going to be there, because already there's lots of theory to study. Yeah, I mean, why would you want to go and observe?
Yeah. I mean, I just sorry to interrupt, Dr.
Not
Saraswati.
at all. Yeah.
Again, doing things prematurely also. See, what happens is just to inculcate the aspects of practice management. If we let kids or first and second year students just observe things, they won't be able to comprehend what's happening. Observation is not just looking at something. Okay, you're keenly noting it down, and then you're probably making sense of why and what of everything. Okay, so even to observe, you need to develop a certain sense of maturity. So once you're familiar with all the concepts of dentistry, you know the various treatments, and our dental structure is probably our dentistry. The course is the one which is so beautifully packaged. So at the end of 5 years, okay, even your internship, okay, is compulsory rotatory internship, so that you're not biased towards one particular treatment or something because of whatever reasons. So at the end of internship, you are actually on the verge of looking at things without any bias. So the true sense of observership would, I think, commence after BDSM. That's my personal opinion. Yes, Dr.
Right,
Sir.
sir.
Well said, Dr. Denzi. Completely with you on that.
Yes, Dr. Imran. Yeah.
Yeah.
Please.
Thank you.
Dr. Imran from University. Yes, sir.
Yeah, I'm actually both clinician as well as a part, lecturer. I can sense a bit of urgency in the student's mind when she told by observing she can earn only 20%. I beg to differ because learned most of my dentistry just by observing. What happens is you have to understand what procedure they're doing. You can mentally prepare yourself next time when you're doing. It's basically what's happening is she doesn't know what she's observing. Basically, most of the Indians they do that. It's basically go back to the theory. Understand what are the words they're using, what are the materials they're using. It helps them. Basically, just observing for the sake of observing, you will never get anything out of it. So basically, it is the interest which I feel in the current, the dentist is lacking because they want to learn everything, in a go. They want to become an aesthetic dentist. They want to become an endodontist. They want to become an orthodontist. You don't know. They want to become everything, in a set of, matter of
Even
1
given
year.
a diagnosis for
It
that.
doesn't. It's not going to happen.
Yeah. Sorry to interrupt, Imran. So I've given a diagnosis for that. It's called classic internitis. They say in internship, students think they can be anything. I mean, you take it in a positive sense, but of course, yes. So yes, Dr. Imran, please. What are your thoughts, Imran sir, on what needs to be taught about dental practice in Yeah, I think we have some network issues.
Or Denzi, if you don't mind, can I just go?
Yes, sir. Please, I think answer is
Yeah, I just have a quick question, and I would actually leave the session if you don't mind.
Yes.
Ma'am, one thing which
It is good. I'm not telling that it is bad. I'm not saying that it is bad.
Yeah. Go on, Imran sir. Then we'll have the question by answer.
What happened is in my college also, I tried to think of. Yes, I think so.
Okay. I think there is a network issue. Never mind. Vikrant sir, please go ahead with the question.
Yeah, so I have a question, and two, I would also like to make a honest submission here.
Let me finish. No problem.
Yeah, one thing is that
Hello?
with regard to, I'm not sure whether you covered it, Dr. Shanbhag, that with regard to the health of dentists themselves, dentists' personal health during these early years as well as during the practice years, what effort, because see what today's lifestyle is totally different, and everyone goes to a gym, goes to does many things, but still many of them are not still into that that kind of habits. So what I intend to bring about here is dentist's own personal health, which is very important and has to be inculcated very early, because we have long working hours.
Right.
You know what type of work we do, so I don't have to tell anyone about what kind of work everybody is doing out here. So that is one thing which I would add to whatever you said. If you have said, great. If you haven't, I would request you to surely keep that in mind next time when you do share your views. And I would that's one thing. And second thing is, this is a total personal observation, is we've seen a lot of practitioners teaching in dental colleges do not share practical secrets out. So because today's student is tomorrow's competitor. So, so I may not be doing practice, so it's okay. So I have like
Yes,
dropped my towel
me
there.
too. Me too, sir.
Practice, but दूसरा वाला जो है ना, वो सोचते हैं इसको पढ़ाऊंगा ना तो कल को मेरे क्लिनिक के सामने इसका क्लिनिक होगा. So that is something which is obviously.
Agree with you, sir.
And talking about one this is the second, this is the observation, and the third and last, I'll just stop here after this, is that we also have something on communication skill development, and we do teach students about communication skills, like whether it's not about taking case history. We're not talking about communication skills with case history. We talk about communication beyond case histories. We talk communication as a tool, like you already told. Networking, you use such beautiful examples, and you use such beautiful anecdotes that you have experienced. I think I'd like to go back to this YouTube recording of this and see, and literally pick up points which maybe we can talk to students, and we will refer to this lecture while ma'am, I would like to congratulate you for that. We'll refer to this presentation of yours to tell students that, please, if you really want to learn, go listen to this one. At least I will recommend myself. Thank you so
Thank
much
you,
for
Doctor.
your
Thank you.
lovely presentation and all
Thank
the.
you, Dr. Vikrant.
Yeah. Thanks, Denzi.
Yeah. Always,
Thanks,
always,
Denzi.
always.
And one last thing. I have done my MBA in healthcare administration also.
Okay.
So that's something which I pursued in 2011 and till 2014. So that's something which that's why I may be a little bit speaking on those lines. But thanks a lot, Denzi. Take care. Thank you so much, ma'am. Thank you so much.
Thank you, Dr. Vikrant.
Thank you.
It's been a pleasure.
Yes. Yes, Dr. Imran, you can go ahead. I think the network is a little weak, but you can. Please.
Yeah, I think so. Yes. Yeah. To come to that, basically the students have to learn, the observership is going to help them. And, basically, the more they work with the senior dentist at one particular place for a bit longer, they're going to get a lot of secrets out of it. And basically the way the dentist treat the patient, the way they talk to them, these are the small things. Basically the problem with almost all the young dentists is, they want to build a Rome in a day. And I think we have to keep them reminding Rome is not built in a day. That will solve most of their problems. That's what I feel,
Yes.
And I think, we all have taken our time, we all have taken our experiences, in establishing our clinical setups. It doesn't happen overnight. We need to put our efforts. As ma'am said, to be on time, being a public health dentist, that's one thing which I was lacking. I'm trying to put it up, in that way, because we are putting up a lot of social work. We'll be in the awareness program on that side and this side. But let me tell you that being on time is the best thing you can do in your clinical practice. Doesn't matter you have a patient or not, but you be on time. If you're put on the board 4 o'clock, you be there at 4 o'clock. In fact, 3:55
Absolutely.
is much better.
Totally agree with you, Dr. Imran. I mean, that's actually spot on, because successful practice, okay, let's not even go to the business aspect. For practice to be really successful, you got to stick to your schedules, you got to be on time, everything, being courteous, and see, dentistry requires a lot of skills, guys. I mean, like I said, the colleges, we teach the art and science of all of that. Okay, but we need to learn the practice of it, because in the end, why do we see very few people excel at what they do, and the skill and the knowledge is known by many, and it's not necessarily that it's your handwork which makes you really successful. So it's also all the other factors, I think, which was covered here. All right, thank you, Imran sir. We have Komal. Yes, Komal, please go ahead. Yeah, introduce yourself, Komal, please.
Good evening. Yes. Good evening, ma'am and sir. First of all, I'll just like to take a minute and tell to sir that it's been amazing. Whatever presentations you have been doing and all these seminars have been immensely helpful to me. And ma'am, all the questions were almost answered, but I'm an intern as of now. So how do I network at this point, or how do I increase my network, and what else I can do at this point, so that later on in my life I can have a better scope for opening a clinic and be a little more successful? It's what I want to know.
Sure.
I mean, as of an internship.
So you're asking about
Yes, ma'am.
networking, right, Komal?
Yes. She's
Yes.
referring to network.
Yeah. So Komal, at your age, I mean, I'm 40 and I still like dancing. I've signed up for. I mean, I've professionally learned jive and waltz. So, halake, I don't go dancing every night or not even every month. So you need to look at, what else, what apart from dentistry interests you. Let's say it's dance. Let's say it's, learning a new musical instrument, or better still, a marathon. If you plan to run the marathon, join a club, get going there, join a local gym, basically explore. If you don't know at this stage what you like to do, whether it's music or arts or whatever, then एक एक महीना सब जगह पे जाओ. I think like Rajeshri, right?
Yeah. Yes,
Had
yes.
mentioned कि 3-3 महीना में एक एक जगह पे काम करूंगी, तो आप एक एक महीना हर जगह पे जाके take different trainings. See, it will also help you to, it will help you, one, to make friends, which I think is very, very important. All right, because these are the people who are going to later on believe in you and come to you when you start with your own practice. And more importantly, it will also tell you what you like. So at this stage, and if you want to give back to community, a lot of organizations have dental camps. Of course, I'm talking about pre-COVID times. Like I said, I'm hoping this, we are going to go back to normal very soon with the vaccine out. So if there are any local bodies arranging these camps, let's say even if it's a medical camp, there are a lot of camps for ophthalmics and ENT and all that. So become a part of it. Start giving back to the community, start serving the community. It doesn't have to be like, music and dance. Maybe that doesn't interest you, and that's fine. You have to find out what interests you, you know so do that. I think at this stage that's more than enough.
Thank you, ma'am.
I hope that answers your question, Komal.
Yeah.
Right. So I think this is a very good time, like, because I mean, Rashi, a little while ago, both of you all, I mean, many more people, students here who've just completed their thing. See, it's good to be eager to know a lot of things, but let me put it this way, okay? You've got to be really selfish while you're learning, okay? So use your time very, very judiciously, okay? Don't end up jumbling too many things for the sake of it, because in the end, like ma'am said, community interactions is very important. So any activity which pulls you in the heart of it, okay? If you like to collaborate and work with some organizations, there are many NGOs which give you internship as well for 3 months and 6 months. Okay, so this is a period where stay open-minded, and networking happens by default. Okay, as long as you're willing to do it from your side, I think there's always, we're being and surrounded by so many networking systems and activities, which is definitely going to take you places, right? So either you discover it through your hobbies, or you discover it through any of your interests, or even, with a dedicated service organization, you can always network and build on it. And like they say, right, today it's not how much you work, or, it's not hard work. It's actually a network which determines how successful you are, not because the network gives you success, it's because you're working in the right direction. Okay, that's how networking adds. Networking by itself doesn't, overcome all the other normal parameters. It's still the cliche line of hard work through your success. But now you're better positioned, and you're better empowered, and you're better, in control of your situation. If you're able to do, and especially look at this, like if it wasn't for an online medium, we wouldn't be talking here from different cities and different countries, right? So you took a conscious decision to attend this, and you've started your networking. So good job on that, Komal.
Thank you.
All right. Yes. Yeah, Rashi.
Thank you, Denzi sir. I just wanted to add one thing.
Yeah, please.
As undergraduate students, after our final years, we feel like probably, we'll feel better. There are no studies. We're opening up to the world. But then internship is a period when we suddenly start feeling very lost, because there are lots of things coming up in front of us, and lots to learn, lots to choose from, lots of decisions to make. So I'd really like to thank you for, giving us a guide that we never expected suddenly. Because of this online platform, we are getting experienced people who are so honestly putting out their views. That really helps us. And I'd like to thank ma'am and you both for giving us this wonderful presentation and guiding us through this time. Thank you.
Thank you so much.
Thank you, Rajeshri.
That was the whole
Thank you,
point
ma'am.
of this, actually. Like, I wanted Dr. Saraswathi because I wanted an honest presentation. Because see, I could have made it, just like theory class on practice management. I mean, I teach that in my college, but I don't know because I'm not a practitioner. So I really wanted someone from the field to give you honest observations. Even, I mean, you could see that opinion being seconded by Dr. Vikrant and Dr. Imran, who are all faculty in various, all of us are public health dentists. So we are not qualified enough to teach about practice management. And the irony is, the Dental Council of India puts dental practice management for some strange reason in our specialty. Okay. And it's just a 1 hour topic. Can you beat this? Like, it's a 1 hour topic. What am I supposed to teach? Right. So, I mean, this is the only way out of it. Like, is to get someone, as experienced as Saraswathi ma'am, and, who's, who did, thankfully oblige for this. And I mean, come on, otherwise 2 hours on a Saturday evening, people don't give up, right? I mean, we are still comfortably at home, but she's in her clinic right now. So thank you so much, Dr. Saraswathi, for doing this and for making this possible. And this will travel a lot, I'm sure. And I know for sure that this will travel a lot. Yes, thank you, ma'am.
Thank you, Dr. Denzi, and thank you everyone for being such a wonderful audience. I'm telling you, the pleasure was totally mine. Thanks a lot.
All right. Okay. So any more questions? I think if that's this thing, we can wrap up for today. Thank you so much, guys, for making time. And of course, the video is available on our YouTube channel. Thank you, guys, who are watching it live on our YouTube channel as well. And definitely we'll put this forward. Thank you all so much. Again, stay home, stay connected. Have an amazing Valentine's Day tomorrow. Have a great weekend, guys. And see you all very soon. Thank you so much. Thank you, Dr. Saraswathi. Thank you.
Bye-bye. Good night.
Yeah, good night, guys. Bye-bye.